Deborah, Duncan. Good morning, everyone, and welcome to Great Day Houston. I know you're wondering, why is she talking like that? She's not from England. Why is she talking like she's from England? I've been to England, but I'm not from England. So, well, neither is the woman who made news recently when she went in for surgery and woke up with a British accent.
Don't know me. Hey, where are you from? I'm from Rosenberg. Oh, where's that? I'm like, we're here in Rosenberg.
Okay. Believe it or not, it's actually a rare syndrome. So let's talk about that in our Medical Monday Hot Topics. And on our panel today, welcome chiropractor Dr. Tony DeRamus, cardiothoracic and vascular surgeon Dr. Tom Nguyen, ophthalmologist and LASIK surgeon Dr. Colby Stewart, and ENT specialist and surgeon Dr. Raza Pasha. Good morning.
Morning.
Okay. Let me first ask audience members, and I want you to be very honest with me. Have you ever gone out of town and decided you would fake an accent? Raise your hand. Raise your hand if you've done this. Raise your hand if you've done this, right? Yeah. And then you act like you're from a certain country and someone starts speaking to you in that language. You're like, oh, hold up, I'm just joking, right? Okay. So they say this is a rare syndrome. She went in for jaw surgery and all of a sudden she woke up talking like this.
Rather rare, but I do have an accent, but it's a Texas accent. Most of the time, anyways. It's an odd thing. I've talked to some neurologists about this, and we have many parts of the brain that are related to understanding speech, speaking speech. The cerebellum's a part of that. But when you watch that video, you think, geez, this is well rehearsed. Where could this be coming from?
Yeah.
But part of it says, I don't want to say she's faking it because that's not fair to her, right. Is it?
Yeah.
But hopefully we find out the reason why.
Foreign accent syndrome. 100 people worldwide in 100 years have been diagnosed with it. You may have heard when George Michael, right? He woke up and he had a West Country accent, like a Western country kind of accent. All of a sudden, he went from being English to suddenly going, "Hi, y'all." Right? Okay. Well, they say it's
it's actually a change in their speech.
Okay.
So in their articulation, because your accent, there's a lot of things that go into your accent. So it's almost like they have a mini stroke in your speech center. At least that's one theory of it.
Yeah.
And because of that, they have a change in speech, and their accent kind of just is
mimics
different, mimics something else,
yeah.
and that they slur a little bit more, and they may mimic, a southern accent if that's the case. It's not like they pick up foreign words and all of a sudden understand a different language.
Yeah.
They're speaking like Vietnamese, that they speak.
Yeah, they've never spoken it before.
Sure.
All right. It is National Sunglasses Day, so let me get my sunglasses on. There we go. Yeah, right. Okay. And so the question is, because when you go to those places, sometimes they'll say, well, the reason why these sunglasses are $1 billion is because they have a special coating that protects your sun, right? So is this really basically a man-made up type of thing, and it's all about really fashion, or are we really protecting our eyes when we put the sunglasses on?
Well, I mean, obviously, when you're wearing sunglasses, it helps you. It's more comfortable.
Yeah.
If you were a fisherman, it helps you see better. UV protection, the forming cataracts, that's still questionable. I think you hear a lot of people selling glasses by this helps prevent cataracts, but there still really isn't that much scientific and peer-reviewed data out there for that.
Yeah.
But definitely. I wear sunglasses when I fish for the polarization, so you can be able to see the.
I can imagine somebody trying to sell these sunglasses to you.
Yeah.
And are the eyes actually made to, they are actually made to deal with bright light, dim light, right?
Right. I mean, and the pupil dilates and opens up at night, so they help you see better. But when you're wearing sunglasses, it's definitely more comfortable. And there are other things that, UV light affects the skin. We know that for a fact.
Right.
Cancers of the skin and eyelids is very common. And, having some type of protection, whether it's sunglasses or some type of lotion, also will help.
Yeah, our makeup artist this morning said, oh my gosh, you have to wear sunglasses. The squint factor causes wrinkles.
The problem is that, when you have you're in a dark room, your pupils dilate, so there's more rays that get to the back of your lens. So if you have sunglasses that aren't well made, you actually have more, ultraviolet rays that hit the back of your head. So you got to make sure those sunglasses are very well made and protected.
Because you're opening that pupil.
You're opening the pupil, and you actually get more radiation to the back of your retina. So.
Okay. You all, of course, are familiar with WebMD and all those types of things, and you have the patient who comes in and says, well, I read that this is what I have right here, right? And you enjoy the fact that people are getting more involved in their health, but to take it with a grain of salt. They have a Google search medical advice. 1% of searchers are symptoms related. Search results can be confusing for a lot of people, and of course when you're trying to diagnose yourself. So how do you all feel about all these different things out there that help people to diagnose themselves?
I think every one of us have told a patient, either joking or seriously, to don't go Google this.
Yeah.
But in the same side of it, we Google things as well. No, absolutely.
Yeah.
You know, right now technology and medicine are starting to converge together, and we can't stop this information taking place. So what Google's going to do is take the most reputable sources and compile that together. So now we have patients that can either say, I don't need to go to the doctor for this,
right,
or let me go because it's a serious condition instead of waiting for too long.
Yeah,
So
but
I
know someone who said, I'm not going to go because they were scared, and they hit every one of the factors for having some heart conditions. And I'm like, well, this is when you need to go. I'm scared.
There are 2.6 million searches on Google every second. And of that, 6% of people who actually want healthcare information actually go to the internet. So it's interesting. I think it empowers patients, it educates patients, but you got to be really careful. So let's say if you wanted to pet a four-legged animal, you Google four-legged animal with a tail. You can come up with a cat, a dog, an alligator, or a lion. That's all very different.
Yeah.
So kind of, or a dragon, right? So by the same concept, if you have chest pain, it can be something very benign, such as reflux, or it can actually be a heart attack or a tear in your aorta. So that's actually really important. So
it goes everywhere from just being a nuisance to you have 15 seconds to live.
Right, absolutely.
Yeah. All right. Okay, this new thing here says there's an unusual warning for those using their smartphones in the dark. 2 women went temporarily blind from constantly checking their phones in the dark. I mean, how many of you get up in the middle of the night and check your phone, right? And it is kind of a bright light, but going temporarily blind?
I mean, it happened to me this morning when I was making sure I got here on time. I got up and I looked at my phone. And
but you can see, though. You saw how he got here.
Temporarily. I mean, it takes the retina time. If you've ever come in from a really bright day and come into a dark room, it's hard to see. And that's just, you know, your retina and the rods and cones in the retina having time to their refractory period to come back so you can see better. So, I mean, this is definitely something that is real, that happens.
Yeah, but not dangerous.
No, it's not dangerous. And these particular
unless you're driving right after that.
These particular people were looking at their phone with one eye closed and one eye open. So that's what was kind of giving them some disparity.
Yeah. All right, Dr. Pasha, we're constantly doing research on sleep and how much sleep we really need. New sleep guidelines for babies and teens. They say not enough sleep, of course, put kids at risk for mental and physical issues. But they're saying infants 4 to 12 months need 12 to 16 hours. I'm like, if you sleep 24 hours, I was happy with my son sleeping. But then it goes on down the line, 9 to 12 hours for kids 6 to 12 years old.
Says a CBS News